black cloud that's going to be here. So. And we also had the thunder snow last night. It was bizarre.
Yeah, very strange. Very strange.
I took the dogs out at precisely 9:20 for their before bed whittle and got them into the house and closed the door and heard this loud noise. And I thought that a car accident had just happened on Warden Street. And within 10 seconds, it was sheets of rain and hail coming down. So I got them in just in time, so I didn't have to towel dry them. So
Timing is everything.
Rob, I see the live stream, the recording. Go ahead.
Yep, just getting it posted to our website here as well.
Thank you.
All right, you're good to go.
Councillor Millen, as Vice Chair, I'll turn it over to you. We do have quorum with the exception of Warden Hicks.
Very good. Thank you, Madam Clerk. Good morning, everyone, and welcome to our Healthcare Funding Roles and Responsibilities Task Force meeting. I will call the meeting to order and ask if there's any declaration of pecuniary interest related to any item on the agenda. Seeing none, if one should arise during the course of the meeting, feel free to declare it at that time. I will welcome our stakeholder delegation. I see Carl Kuhnke. Is that how you pronounce that?
you did a very good job.
Well, we're off to a good start then. So welcome, Carl, and welcome, Brenda Campbell. I see she's on the call as well. So I will turn the meeting over to you, Carl, for your presentation.
And thank you, acting meeting warden.
Meeting counselor.
I know why Selwyn hasn't joined, and that's because he got this presentation 3 weeks ago when we presented to Hanover Council. So,
oh, I see. Okay.
I hope that's not why, but we just want to take about 10 minutes of your time this morning to talk about to update everyone on what Saugeen Hospice is doing as it is focused on Southern Bruce and Southern Grey. And we have been in existence for a grand total of 5 months now, but we're moving quite quickly with the able assistance of 12 volunteer board members, including Brenda, who of course is well known in Grey, I think, for her role in various school activities. Should we put them? Or how about if we just say this morning that the Bruce Grey school buses were all canceled at 6:30 this morning, and that's probably because Brenda isn't there anymore. So, a few words on now. Do you have our presentation up in front of you or not?
I can share my screen.
Can you do that? Because yes. I probably can't. So that'd be great.
Can everyone see that?
Yes, ma'am.
Perfect. And you'll notice it says November 12th, but the Health Care Task Force is even better for us. So if you could flip to the next one, that would be great, Heather. So you're all well aware of the hospice environment in Ontario, as are we. There are 4 types of palliative care in this province. Hospitals, of course, Hanover, Owen Sound, others. Long-term care like Rockwood Terrace and others in Grey County, and then home care, which is not talked about as much and isn't as visible as a giant hospital, but still a significant component of palliative care. And then there's residential hospice. And as you know, is sitting in Owen Sound is residential hospice of Grey Bruce. And it was established 4.5-5 years ago now and is doing well. And the issues that hospices have, and especially if we look at Southern Grey and Bruce now, is that acute care and long-term care, which are very expensive, are 100% funded, as you know, as part of healthcare. But hospices are not. And although those of us on the inside know that, it's not very surprising when we go to the public and they say, "What do you mean the Ministry of Health doesn't fund hospices?" But they don't fully. It depends heavily on the community, on fundraising and donors, and the government will fund for capital costs up to $200,000 a bed. So if you're looking at a 5 or 6 bed hospice Owen Sound with 8, 9, 10. If you're looking at that now, today, with all the new requirements the Ministry of Health has put in to build a hospice because of COVID, the actual cost stated there as $1 million is actually over that. So if we're looking at a 6-bed hospice here in Brockton with the land donated by the municipality, we're probably looking at 1.2 million per bed. So by the time you're done, you're looking at $6 or $7 million. And then for operating costs, the government will fund $105,000 a bed per annum, but the cost is easily $175,000 a year. By the time you start doing the food and the cooking in the kitchen, and of course the clinical care, the government is covering about 52% of operating costs. Next one, please. So who are we? We were incorporated in June of this year, only 5 months ago, following a decision by RHGB to stop accepting donations for a hospice in South Grey Bruce. Physically, it's going to be located here in Brockton, but it's to serve Southern Bruce and Southern Grey counties. Our board is a dozen with very deep interest in residential hospice. Many have been involved for the last 5 years with RHGB in trying to get the South Hospice built. And 2 of our board members, myself and Kelly Fotheringham, were on Residential Hospice of Grey Bruce's board. And as a result of their decision to completely stop accepting donations for anything to be built down here, we actually left that board and formed Saugeen Hospice. So we've got a really diverse group of everything from palliative care nurse. In fact, Edith, who was a palliative care nurse at Chapman House and who lives down here. We've got logistics experts, lawyers, chartered accountants, Ken Brown, retired owner and founder 3rd generation of Brown's Pharmacy, who, as you probably know, through Brown's Pharmacy provides all of the home care medical aids and medical care funded by the Ministry of Health to everyone from Owen Sound to literally down to Wyerton to Goderich. We have a municipal councillor who is also a Bruce Power and Walker and firefighter. We have a retired diplomat. I won't tell you who he is, but that's probably me. Currently the CEO of the Clean Water Center. And we have piles of supporters. We're up to well over 400 now, and we have a very solid social media presence. Next slide, please. And so why do this? To our supporters down here, which have been working hard on this for 5 years, everyone recognizes there is a very broad need for palliative care in South Grey Bruce in a residential hospice. Closest is Owen Sound. Actually, physically, the closest is Tiverton, which is a little less, about a 40-minute drive, 35 to 40-minute drive from here, but it's a 2-bed hospice. That's called Huron Shores. And that is co-located in a long-term care home. And they only have 2 beds. And then, of course, there's Chapman House in Owen Sound. This whole region, as you all know, has a hugely aging population. And to ask an 80-year-old whose spouse ends up in hospice to drive to Owen Sound daily to visit their spouse in February, we were all just talking about the weather, it's an impossibility. We've had a couple of individuals who are supporters of ours who actually outlined their stories to us of having husbands or wives in Chapman House last year. And they literally, at the age of 80, had to hive up and move into a hotel in Owen Sound, away from all of their family. And they had to be driven up there, and because of their age, they couldn't drive to Owen Sound in the middle of winter. So the hospice down here has been around for about 5 years as a committee of Chapman House. The Ministry of Health gave Chapman House $180,000 for planning, but to date, only $37,000 has been spent. And rightfully so, and we don't speak for residential hospitals of Grey Bruce, but 2 years ago, they said, we're delaying the South build inevitably because we're having enough issues funding Chapman House. And clearly, if you're a board and you've got a staff of what they have there, which is like 16 people, full-time staff of 16, and your funding depletes, you do have to focus on what you do. And so on June 30th of this year, after a March board meeting, it actually also stopped accepting any donations for any south build down here, which has affected a huge majority of the donors down here who were committed to building something here, not necessarily adding to the operational revenues of Chapman House, but building something down here for themselves. And so they had nowhere to put their money. Next one. So our plan, we need to come up with $1 million to be authorized by Ministry of Health to begin with a plan for 6 beds. And then we're going to need $400,000 a year to operate. Just to compare this to Chapman House, because of the way they built Chapman House needs a minimum of $1.3 million a year just to meet their payroll. So we're looking at starting small, and ultimately, of course, we'll have some staff, but nothing the nature of what Chapman House has now. So fundraising and donor relations are very critical for us right now. We've always had, for the last 3-4 years, our Golf for Hospice. We raised $150,000 in June of this year in 24 hours, in a 24-hour event with an online auction. That all went to the Residential Hospice of Grey Bruce's segregated bank account, because we, at that point, had just been incorporated and didn't even have a bank account. On June 29th, that money was driven up to Owen Sound to meet Chapman House's June 30th deadline for no longer accepting donations for the South build. So that's the last of the money that went into the account there. We've also had Hike for Hospice. That's down here alone has been well over 100,000 annually. We're looking at a number of initiatives right now, including galas once we all come out of COVID. Our service clubs here are very active. We just accepted a check last week from Mild May Rotary for $2,500. The Hanover Rotary is going to be donating another $2,500 or so from a quilt draw that we've all been selling down here. And in fact, the winner of the 50-50 draw from the Mild May Rotary draw, for which we got $2,500, and the South Grey Bruce Health Foundation, Walker and Health Foundation, got the other $2,500. The woman that won the $5,600, 50% of that, announced the minute she got it that as soon as we receive our charitable tax status, which we expect in February, she's going to donate the entire $5,600 to us also, which was really quite amazing to hear. So we've got a harvest for hospice and planning with the agricultural community, some car rallies planned, and also we're looking at major donors right now. As you probably know, Chapman House actually got its kickstart with a $1 million check from Chapman's Ice Cream, and that's what really put them over the top so that they could build their building. Next one, almost done. So Chapman House is sitting on $700,000 in a segregated South Build bank account that can only be used for the South Build down here. They also have charitable tax status. We're looking at February for ours, but in the meantime, there's really nowhere to donate particularly large sums of money where you wish, the estate wishes, in the case of an estate, to get a taxable receipt for the $200,000, $300,000, $400,000, $500,000 or $600,000 you donate. And right now we can't do that, and Chapman House is not accepting any. So we've entered into formal discussions with MOH, also with Bill Walker, of course, and Lisa Thompson down here, and their senior officials. And we're working on alternatives to either have a new license for Brockton, which is physically where it'll be located in the East Ridge Business Park, a new license given to us, or to somehow work with Chapman House to have that license at some point transferred to us in a collaborative effort. We are getting donations all the time. Our funeral home partners are quite significant. We do have a bank account. We are paying our bills. We do not have staff yet, but we also have over $500,000 sitting in trusts right now down here with lawyers waiting for our tax status to be declared. And once that happens, we will have well over $500,000 in our bank account. Next to last one. So what are we looking for from Grey County? Obviously, your full moral support. Southern Grey County is in Hanover and surrounding area, and Durham are are critical components in Grey County, and they're very, very positive supporters of the Southern build here. We are looking for startup capital. Funds are tied up, as I said, with Chapman House until we get a decision from the Ministry of Health. But we've got our website underway. We've got our Facebook page up. We just today are doing donations directly through our Facebook page. We've got e-transfer set up now for that with Meridian Credit Union down here. And we're all volunteers. So we've basically been paying out of pocket. We do have some money in our bank account now. So those of us that have put in a pile of money can start getting paid back. And so this original presentation, which was to Grey County Council, was to request a grant of $10,000 from Grey County Council to enable us to actually get started a little more and perhaps hire a part-time person down here with the capabilities to help us fundraise. All funds are transparent, of course. We're a not-for-profit corporation, as is Chapman House. Our treasurer is Elaine Burrow, a well-known chartered accountant in Hanover, and we are up and ready to go. Last one coming up, and that is just our contact information. Myself, we have, of course, email, askus@saugeenhospice.ca. If you go to our Facebook page, you just have to go into Facebook and then type Saugeen Hospice, 2 different words. You'll come up with a very active Facebook page, and our donation page will be starting today. And our website should be up and running in a couple of weeks. You'll notice throughout, by the way, if you're not familiar with palliative care, that we have the hearts and the butterflies throughout this presentation. Those are the 2 international symbols for hospice care all over the world, and that's why we use them, and also in our logo. And I think that's it. That's us with a butterfly and a heart. If you have any questions, Brenda and I would be happy to answer them. And if not, we'll let you get on with your healthcare task force, because we know that a healthcare task force has got a lot of work to do. We have heard, by the way, before I finish, that there may be some changes being made by Ministry of Health. So as you consider what you do, including for Chapman House, there may be changes coming up, shall we call it pre-election, that may see additional funding for hospice on a long-term basis across the province. We don't know exactly what will happen. We're a member of Hospice and Palliative Care Ontario, the association, HPCO. We know that they're working hard to try and get the operational costs raised from 52% or $105,000 a bed to 75% of annual operating costs, which would be a tremendous benefit to every hospice in the province, all of whom have suffered, like all charities have, from a drop in COVID donations. So I'll just finish with that. And if you have any questions, we're more than happy to answer them.
Excellent. Excellent. Real good presentation, Carl. I can very much sense the passion you have for this project. So that's great. Any questions from the committee to the presenters? Well, you must have done a really good job, Carl. Well, I know you did.
It was so clear, we're good.
Absolutely. No questions at all. So I thank you very much for your time, both Carl and Brenda. We certainly appreciate your efforts to bring this project to fruition, and we'll be back to you, I'm sure, with some kind of communication in the not too distant future.
No problem. And I should, just on closing, if any of you individually wish to be kept up to date on Saugeen Hospice initiatives with your home emails, your personal emails, all you have to do is send an email to askus@saugeenhospice.ca. You'll be added to our distribution list, because we do at a minimum monthly get these updates out to all our supporters, upcoming activities and everything we're doing. So just fire an email off if you're interested, and you'll be added to our list.
Excellent. Very good. All right, then. Thank you. And I bid you a good rest of your day.
Enjoy your deliberations.
Thank you. Very well. So we'll continue on with our agenda. The next item on the agenda is number 4, reports, and there's a healthcare funding policy report there from CAO Kim Wingrove. So Kim.
Good morning, everyone.
Sorry, Mr. Chair, could we have a mover and seconder to put her recommendation on the floor, please?
Sure, we can. It is moved by Barb, seconded by Tom. Okay, Kim.
Excellent. Thank you so much. Good morning, everyone. So what we have before us this morning is the proposed healthcare funding policy for your consideration. And just by way of some background, we started this back in November of 2019. COVID intervened, but we have heard from a number of stakeholders. Our mission was to develop a healthcare spending policy that would guide Grey County Council's decision-making regarding funding requests from healthcare stakeholders, and to outline a rationale from where municipal funding should be allocated and the criteria for eligibility, as well as maximum annual reserve contributions. So that's where we started from. I think the other piece of background to this and consideration in setting a healthcare funding policy is an appreciation for what the county is already doing. And the proposed principles to guide county healthcare funding decisions are made within the context that all upper tier municipalities already provide significant resources to healthcare through the portion of county levy allocated to long-term care, paramedic services, and our support to the health unit. For Grey County in 2021, this amounted to 27.4% of our levy, or over $17 million. Ontario, just by way of background, Ontario is the only province where municipal governments are directed by legislation to play a role in funding and delivering those health services of paramedics and long-term care. So moving on from there, we talked to a number of stakeholders, all of our hospital corporations, Grey Bruce Health Services, South Bruce Grey, Hanover, and we talked to Georgian College, and this morning we also heard from Saugeen Hospice. We heard from the Intermunicipal Physician Recruitment Group, and I think coming from all of those conversations, we heard some consistent themes in the presentations, that fundraising is both required by the province and also critical to getting the projects done. The need for fundraising is ongoing. The project costs are rising quickly and escalating the proportionate share that's necessary to be raised from the public. We took a look at what AMO had put forward back in 2019, their Partners for Health Ontario paper, and the operating principles behind the Simcoe County Healthcare Funding Alliance. Now, the discussion about the Simcoe County Hospital Alliance, I'm sorry, I misspoke there a minute ago, was very early in our deliberations. Slightly different set of circumstances than the ones that we have before us in Grey. Because Simcoe, I think, is putting quite a significant amount of money on the table over a long period of time. They, I think, had some leverage to get that healthcare alliance put together amongst all of the hospitals to get that level of cooperation. So I'm not suggesting that we go down that road, although we can certainly talk about that. What I did think that was that there were some key principles in the Simcoe County work that we should try, as much for consistency as anything else, to incorporate into our proposed policies. That idea of 20% of inpatient and day surgery services were being offered to Simcoe County residents. The fact that the capital project that's being funded has to have provincial approval, that there must have been consultation taken place with other healthcare sectors in the region. The other thing, the one thing that they have that I didn't include in ours is that they are only making payments based on actual eligible expenses. So they, through their annual allocation to the Hospital Alliance, they're providing back-end support rather than front-end support. And I'm suggesting that front-end support might be something that we wish to be able to provide, since it's often so critical, like we saw in the case of the Georgian College ask to be seen in that leadership position and really getting things started in a meaningful way. I think can help to enable the future fundraising efforts that the organization is attempting to do. So from there, what the report lists is some principles and rationale to underpin what we're proposing. So first of all, we have made and will continue to make significant contributions to healthcare delivery through levy allocations to paramedic services, long-term care, and public health. We also support the health and well-being of our residents through levy contributions to social services, children's services, and social housing. The second piece was that healthcare funding is a provincial responsibility, and as a county, we support AMO's recommendation that the province engage with them and establish a municipal working group to review the future appropriate and value-added municipal role in hospital funding and planning decisions. The question of the appropriate role for municipal governments in funding healthcare capital and equipment has been raised across the province. The current legislated requirement for a 10% share to be raised through donation places a hardship on rural communities who lack the same breadth and assessment base that urban municipalities have. The development of a consistent, defensible policy in this regard would provide a level playing field and facilitate long-term planning by both the funder and the project proponent. You may have seen, here's an example even from a rural context. I think it was last week or the week before. Brampton's been working hard to see a hospital put in place in that community. I think they've had the go-ahead to do so, but the requirement to fundraise from the community is $125 million. The city of Brampton is considering a special levy on property taxes to be able to fund that requirement. Our third principle, I'm suggesting here that we consider a slight increase to what we're allocating, that Grey County would allocate 0.75% rather than the 0.5% that we're doing now of our own source levy annually to a reserve to fund eligible healthcare projects. And I think this is meant to acknowledge the escalation in project costs that we're seeing, as well as I think in some parts because of the growth that we're seeing in our communities. Projects are eligible if they fund capital or equipment requirements, the project is provincially approved, creates a significant service improvement or responds to an identified need with strong support from other healthcare. The ask is periodic and significant. So we don't want to get into, we're going to fund you every year. This is for a signature project that we want to support. That the project is located in Grey County, or for hospital projects where Grey County residents represent at least 20% of surgical and inpatient population served. Outside of that, funding may be allocated on a percent of population served. The purpose of the healthcare funding reserve is recommended to be a source of funds for large capital projects that provide a significant public good that will be of benefit beyond the borders of the municipality where the project itself is located. These projects represent long-term investments in infrastructure and, as I said, have received approval to proceed by the province. I did provide some comparison just for your information, and pulled a few places around the province ourselves: Simcoe County, Northumberland County, the region of Niagara. You can see there's a huge amount of difference in the budget. Niagara's is so different because they do water and wastewater in Niagara at the region. What their levy is, the healthcare and hospital contribution that they provide annually, and what that works out to be as a contribution per capita. And then what that contribution is as a comparison as a percent of the levy. So at the proposed levy contribution of 0.75% of own source revenue in 2021, Grey's contribution to reserve would have been $448,600 or $4.46 per resident. And you can see when you look across, well, we have not match the level at which Simcoe is funding this work, we are, I think, showing some really good leadership compared to other municipalities around the province. Project proponents seeking funding from Healthcare Funding Reserve will be required to make their request to council in writing by June of any given year, so that we can build it into the budget, that we can make sure that if there are multiple asks that we're able to cash flow that appropriately, because we're building it into the next year's budget. Projects that do not meet the eligibility requirements for funding from the Healthcare Funding Reserve may still come before council as a delegation to make a funding request. But at least by having this policy that outlines what the eligibility requirements are, when someone comes forward, normally clerks or sometimes myself, speaks to them about why are they coming, what's the purpose of their delegation, what's their ask. So there'll be an opportunity for staff to explain to that organization what the eligibility requirements are. So it's very clear to them if they're outside of what's eligible. I can stop here before I go into the outstanding funding requests. Does anybody have any questions about what's being proposed?
Questions from committee members? No, you're doing a great job. Oh, Barb, go ahead.
Thanks, Mr. Chair, and thanks, Kim. As we spoke about earlier, excellent report. And I just want to bring to this committee's the attention a challenge that we've had often in terms of setting guidelines and setting the rules and regulations for a policy development, and then offering an out in terms of if you don't fit that criteria, come to council and make a presentation. I know that the rationale behind this certainly fits, that council is a decision maker. Council will be the one that decides whether a project should be supported or not. But it just it seems to me that if there is a way that, for example, projects might be considered at some point in the deliberations of the funding request, because of the requests that we've had coming forward have been sometimes for projects as opposed to bricks and mortar, which we've traditionally supported. And I know that the rationale being here, this is a recommendation from this committee to go forward to council for approval or amendment as they see fit. But that was a curiosity for me, and I wanted clarification from that, which I got from you, Kim. So thank you for that. I just find that it's something that maybe we need to talk about a bit. Thank you.
If I may, Mr. Chair, one thing
Absolutely.
I didn't put in this report, but is very clear in the Simcoe County policy, is that if you're coming to county for support, you're not going to the lower tiers as well. And so there is that, and that's something I didn't specifically note in here, but certainly could add that to our policy if that was seen to be a benefit.
Yeah, I noticed that there, and I'm wondering if we shouldn't have some thoughts on that from the committee, because myself, I'm thinking, well, I don't want to say double dipping, because it's that's really what it is, or could be. Does anybody else have any thoughts on that? Whether we should include that restriction, Paul? You're still muted there, I think.
I have a bigger conversation. Sorry, I have a bigger discussion, but I'll leave that point for a minute.
Oh, okay. Anybody else have any thoughts on whether we should include a restriction to approaching lower tiers in addition to the county? Tom, I see your thumbs up. Does that mean you'd like that restriction in there?
Yes, thank you.
Barb, do you have any thoughts on that?
Yes, I agree. I think that is something that if we go ahead with this, then that means there is not an approach individually to each of the lower tiers. I appreciate that.
Right. I guess it wouldn't preclude a lower tier on their own initiative,
Yes.
right? It's just that they wouldn't automatically, they couldn't approach them directly, I suppose. Okay. So it sounds to me, Kim, like we'd like to see that restriction in there. Thank you. Any other discussion so far on what we've talked about? Paul, you wanted to suggest something else? Go ahead.
Yeah. I know just briefly on the part about restricting it to lower tiers, but when it comes to, and we've witnessed it with the Markdale Hospital and other, it's tough. It's a tough, and that goes back almost 20 years, right? In the sense of getting that project going. And there is that mandate, I understand, from the province that sort of 10% of a new hospital has to be raised locally somehow. However, that is sort of the mandate, however that shakes out. And I mean, there's nothing stopping that, that fundraising group coming to any level of government to make that request. It's up to council to make that decision, right? We know that, right? Just going back to the policy of the 20%, and I'm saying this from more of a little bit of a high level, but this whole committee started with regards to the request that came from Simcoe County and the Collingwood Hospital and an expansion there and that whole thing and trying to find, and I understand you're trying to level the playing field, so it's a fair and balanced approach. But the one thing that I do want to get more information, but we do have a huge resort, the mountains resort that we've all been at. We know how that has changed over. I remember reading in 1999 where Interwest was coming to town, and there's going to be 50,000 units. And I thought that's crazy, but it happened. It's crazy what's happening there. It's just unbelievable what changed there. But I know when Interwest took over that and I sat on that Collingwood Hospital board for 12 years. And I know the issue that changed with that was the changes with regards to selling ski passes, ski things, ski passes to go on that hill. And they greatly reduced the price because their mandate was just sell. And what they did is from the emergency part of Collingwood General Main Hospital was on a beautiful snowy weekend. I can't remember the number, but the hill was packed beyond a safe manner that was acceptable in the minds of the emergency department. And as you know, a lot of times people are first-time skiers when they buy a pass. It's called kamikaze or missiles or whatever. Anyway, my point was, the concern was from the emergency department is it was a recipe for an issues to happen. And it did reflect a great deal on that emergency department room in the sense of, and the reflection of weather can have a lot to do with recreation. And we know Blue Mountain added more hills since I was on that board. And it's quite a business. It's a business that sells. My point I'm trying to raise here is, given some of that influctuation into our Grey County, as you want to say, and it talks about the 20% residents, I want to get bigger numbers, but on any given weekend, I would like to know what that influx of people coming into that area are, and that reflection on a health service. And I know some of it trickles over to me for this. I'm sure Barb is quite aware as well. It is either you go this way or you go that way, and it depends on the day and getting that service, and even into Markdale as well, Markdale Hospital. But I know we generate a huge tax base from that area, and the fluctuation of people, it's a unique situation that's not normal. And I think across the board, is a provincial, and I'm just raising the point is the mechanisms of having something that brings so many people into Grey County, and not, is there an obligation or a moral obligation as we hear it from our friends at Blue Mountains that 26% goes to the county, and I'm not, that is what it is. It's based on assessment base and all that kind of stuff. But I'm raising the point is having a business that brings in so many people at a given time, depending on the weather. We know if the roads are blocked and the roads are closed, that changes if it's a great weekend. But it's an entity that's in place that is doing it, and it's continuing to grow. And I guess my point is from a fundamental part is, do we have to look at a bit of an exception to that rule of the 20% residents versus an influctuation of people into our area just because of the nature of the beast that it is, and do we have a little bit of an obligation on that sense of funding a healthcare facility on that basis? Maybe, I know it was a big question, a big ask of $3 million, but it's unique to our area, and we certainly are grateful for the assessment base that does come out of there, that does provide. And I know even as we have had to increase our costs for land ambulance and having a base there and rotating ambulances around depending on, all that. And, and maybe that's part of our, needs to be put into the equation as well, because it's sort of something that we're obligated to fund, but it does add cost. And I know that we're trying to find that balance and all stuff. So I just put it as a high level discussion, but it's just that part of, it's unique to that particular item that Simcoe County does have and that policy. So I put it out there for discussion purposes. Thank you, Mr. Chair.
Thank you, Paul. It is a rather unique situation. There's no doubt about it. I guess it kind of boils down to, Kim, and I wondered sort of related to that was, would the 20% be Grey County residents or patients that come out of Grey County, i.e. the influx of of people that come from heaven knows where? A lot of them come from the GTA, but they're coming out of Grey County to look for healthcare in Simcoe. I mean, should that be part of the 20%? I don't know.
Right. So in the report, if I may, Mr. Chair, what I had suggested was that I know time has passed since we heard from Collingwood, that what I wanted to do was go back to them and get more recent numbers. So job one was, we're looking at this. We want to hear from you. Give me new numbers. I would also, I think, like to talk to paramedic services. I know that in recent years, the medics have maybe taken, I don't know what to call it, other than a little bit more of a balanced approach. Nobody wants to be in an offload delay situation where the ER is backed up and people are waiting. So, how much diversion to Meaford is happening versus just as Collingwood, because it was my understanding that we were moving patients into Meaford perhaps more frequently than had been done in the past. The other discussion, there were some preliminary thoughts about whether or not they wanted to have more of a clinic actually on site at the resort itself. And I'm not sure where that discussion has gone, but I'd also want to just follow up on that to see exactly what's happening there.
That could be quite a rabbit hole to go down, that one, I think.
Yeah.
Wow.
So as I say, what I was proposing for right now, not wanting to in any way exclude Collingwood General Marine, but to get some more information from them. And I think that the tourism point that Councillor McQueen has raised is an excellent one. And one thing I haven't done but could before maybe this report comes back to council is just take a little look at what if there are other kind of quote unquote resort communities, and whether they've had any kind of made any kind of sort of unique arrangements with their hospitals to account for that. So let me look into that.
Thank you. Thank you. And, having said that, Kim, I can appreciate that, any delegation coming to council or to this committee, I suppose, their situation is always going to be unique to what they need, or they can build the request to make it look unique, right? So
Right.
anyway, that's good.
Okay.
Any other questions on what's been presented so far? Barb, go ahead, please.
Thank you, Mr. Chair. Interesting concept, Paul, and I really appreciate this broadening the perspective here. I guess my concern about that on the whole is that we are spending Grey County taxpayers' money on this healthcare, additional support for healthcare. Healthcare, as noted in the report, and we all understand completely, is a provincial matter. And those folks coming into our area are guided and are supported by the provincial healthcare mandates where they live as well. So I'd be very, very conscious of adding on additional cost to our taxpayers in Grey County for a typically provincially funded service as healthcare vis-a-vis hospital care is provided. We have this situation across the board where many of our residents, myself included, must go elsewhere for healthcare treatment in some cases. And, I think that is assumed and is right to be provincially funded. Just one thought on that. Just another quick thought in terms of fundraising locally for hospitals and institutions. Our hospitals have set up very successful hospital foundations that do that at the local municipal level. And so I thoroughly support a request from a hospital coming into Grey County as not going, into the lower tiers for that reason. The local municipal hospital foundations are very active, very successful, and they have a mandate to fund their hospital close to home, which is why they're very successful. So I just put that out for consideration as well. Thank you.
Very good points. Thanks, Barb. Very good points. Very good points. And as we all know, it's a complicated issue, but ultimately it is a provincial responsibility, no doubt about it. But the reality is what's on the ground and what's in front of us. So we have to deal with it, right?
No kidding.
Any other questions on what's been presented so far or discussion? No, not seeing any. Okay, Kim, go ahead.
Okay, so I want the section about outstanding funding requests. And so we've talked about Collingwood General and Marine. So we'll get some additional information, but what's being proposed here is that we write them a letter and ask for some additional information. So I hope that that part is satisfactory to you. The second recommendation that the outstanding request, I should say, the Town of the Blue Mountains Joint Physician Recruitment and Retention Committee met with the task force October 19th and requested $250,000 to support a dedicated resource to work with the Rural Ontario Medical Program, fund attraction efforts for first-year medical students, fund a program of summer students to work on a project to identify opportunities for the Owen Sound and Georgian Bay family health teams to expand mental health and senior services, provide provision of transitional housing for new doctors, and a nurse practitioner pilot. So quite a large number of initiatives there. This request does not meet the eligibility requirements for funding from the Healthcare Funding Reserve as they've been outlined because it's not a capital project. The recommendation here is that a letter be provided to the committee advising them of the funding policy if and when it's approved by council, and suggesting that they provide a revised request to council with letters of support from the health teams in ROMP for consideration. So should there be something that they can do within that basket of projects that would fall into the the capital and equipment basket, perhaps there's a way forward for them. But again, sending them a letter and asking them for some additional information. The third one was the request that we received this morning from Saugeen Hospice. Again, this project is to support a capital project for a relatively small amount of money compared to some of the other requests we've received. However, it has not yet received provincial approval and is to be located outside of Grey County, although serving some Grey County residents. Staff recommend providing a letter to the committee with direction as per our discussions today. So I am looking to you a little bit about how you'd like to, how you would recommend handling this. Do we want to inform them of our new policy and suggest to them that in principle, the county is supportive of the additional hospice beds and and ask them to come back when they're a little bit further along with their deliberations with the province.
Okay, any thoughts from committee members on that? Tom, go ahead.
Thank you, Mr. Chair. I think that's a good approach, Kim, to maybe have them return, but I think there's going to be some question. We're going outside the county for sure.
Mm-hmm.
Again, I support it across the board, but I think maybe they should come back at us. Thank you.
Okay, any other thoughts? Barb, go ahead.
Thanks. Yeah, good thought and an excellent presentation this morning. Certainly the enthusiasm will carry them a long way.
Yeah.
I'm just wondering if the 20% criteria of Grey County residents using the facility might be a stake in the sand as well.
Yeah. Okay.
Good points. Good points.
All right.
Yeah, I would agree with that, Kim, that we need to ask them to come back when they're further along on their project. I don't think 10,000 is going to make or break them one way or the other at this point. No. But certainly, hospice is a popular, I shouldn't say popular, but it's a very on everyone's minds issue at the present.
Right. I do regret not asking him if they had approached Bruce County or what Bruce County's engagement was in this. Wow. I should have done that. The next one, number 4, was the Grey Bruce Health Services. Again, at the time that Collingwood came to speak to us, Grey Bruce Health Services also came around that time, and they'd requested $400,000 over 2 years around their MRI project. They were fortunate to receive a private donation for $1 million. And so that allowed them to get over the top with that project. So I don't believe that there's any further action required on that matter at this time. And then the last one, also with Grey Bruce Health Services, when they were here in June, they asked for another $150,000 in support for the Markdale Hospital. Again, open to any comments from this committee. The recommendation here from staff is that we include the $150,000 in the 22 budget, with funds being drawn from a combination of the healthcare funding reserve, which has a balance of $90,548 after we take out the Georgian College funds, and then as part of whatever our transfer to reserve is in 2022, we draw the balance out of that to make up the 150.
Thoughts from committee members on that? Barb, please.
If you have a handle on what we have contributed to date for the Markdale Hospital in terms of infrastructure funding. Don't know.
No, Mary Lou, if you're on the call, I want to say, so there was the land and then the money that we gave them, and I want to say we're around the $1 million mark.
Yeah.
But Mary Lou, is that, yeah?
Yeah, between the donation of the land and the financial contribution we made this year, it's $1 million.
Mm-hmm.
Right. So this 150,000 is the additional that
Is
fundraising, right?
Mhm.
That each municipality was added or asked to top up their original commitment. So
Right.
uh,
Okay.
I'm supportive of the direction that you've suggested in the report here. Absolutely. Any other thoughts from committee members? Nope, not seeing any. Okay.
Okay, and then the last one was just to note that both Hanover Hospital and South Bruce Gray, when they spoke to us, they both mentioned future renovation projects, but didn't provide the task force with a specific ask at that time. So our recommendation here is we write a letter thanking them for providing information to the task force and their assistance in our deliberations, advise them of the policy, and so and letting them know that, you know, should they have a project in the future that would align with the way the policy is set out, that they're more than welcome to bring that forward to us.
Great. Any thoughts on that one from committee members? Nope, everybody's good. Thank you.
Okay. So finally, if approved, the report recommends an increase of 0.25% of own source revenue being added to the levy, and so that it can be put into this healthcare funding reserve. For the 22 budget, this would result in a transfer to reserve 467,600, an increase of 168,500 as compared to 2021. And that is my report, Mr. Chair.
Thank you. Just making a quick note here. Thank you, Kim. So any thoughts from committee on the report as a whole and the recommendations put forward? Welcome, Mr. Warden. Do you want your job back or should I carry on? We're almost done, I think.
No, I can carry on. I apologize for joining late. I had a
Nope, not at all. That's all right. That's all right. Everybody's busy. That's for sure. So any thoughts from committee on the recommendation here? I think they're all well described and well thought out. I appreciate your efforts there, Kim. So I'll not, Madam Clerk.
Thank you, Mr. Chair. I wonder, just after discussions with the committee, if the committee looked like they were in support, generally speaking, of having a small amendment to that policy about requirements that the requests coming from Grey County Council for healthcare funding not be brought forward to any lower tier municipality in Grey County. So that would be an amendment to the policy that CAO Windgrove has put forward today.
So are you suggesting we should have a standalone amendment or a friendly amendment?
A standalone amendment, please.
Standalone amendment. Oh man, we are diligent this morning, aren't we? Well, that's okay. That's a good way to be. So I need an amendment or mover for an amendment to include, as the clerk has just described. Barb is moving that. A seconder. Tom, thank you very much. Any questions or discussion on that amendment? Go ahead, Selwyn.
Sorry, could the clerk please read that amendment for me?
The amendment was that Hanover was going to fund all of the requests coming forward from Grey County.
As they rightly should, yes.
No, that's not what the amendment was. Madam Clerk.
The amendment is that the task force, the healthcare funding policy be amended to include the requirement that requests coming forward to Grey County Council for healthcare funding not be brought forward to any lower tier municipality in Grey County, so that the requests aren't being brought forward to both the upper and the lower tier for this project.
So operationally, how will that work, Madam Clerk? In other words, are we saying to them, don't come to us if you're also going to the lower tiers?
Yes.
Okay.
Yes. That's the intent.
Or perhaps, please come to us. Don't go to the lower tier.
Exactly. Yeah. Okay. You all right with that, Buck?
I am, yes.
Paul, go ahead.
So we know with the current hospital, the Markdale Hospital is, 20 years ago or almost there, they went to all levels. I know sometimes it's challenging when you're trying to bring in a new hospital and, you make that ask. I wonder though, is it something that we can actually say no to? If, I mean, they obviously can make that request to the lower tier municipalities. I mean, there's that's just, they can make that delegation, and it just, you know, can we override the lower tier municipalities, whether they wish to give or not? And the second part, or maybe I got a second part to that, but maybe I'll wait to that comment, just from a municipal.
It is part of the Simcoe County policy
Yeah.
that that the lower tiers I think there was just agreement by everyone that there was one door for for funding. You came to the county and you weren't going to go twice. I would suggest that the way that this is worded, the county is suggesting that people approach the county. If the county funds it, good, then you know. If they so choose to go and make a delegation to one of our member municipalities, we certainly can't stop them. And that municipality is certainly welcome to consider their request and fund it or not. They will do that knowing what the county has decided, because under this policy, you're coming to the county first. And as I guess for all of you, I would say, is that helpful information for your councils to have, knowing that the county stepped up or didn't and provided whatever towards the project?
I would suggest it absolutely is. Sure.
Yeah. And certainly we all know that there's the one taxpayer, whether you pay at the lower or level.
Yeah.
And I guess it could, I mean, that's fine to have that wording. It doesn't stop them to do it. The other part is something that, you know, currently we had that further request that we're looking at, and we had a very successful rodeo that this past fall that we raised $34,000, and we're looking at maybe making that as not a levy per se, but a municipal event that all proceeds go toward that additional or that allocation. So it's thinking outside that box of looking at a different way versus levy, and maybe the wording in this could say that, you know, a levy ask. I don't know, like, you know what I mean? Like if the lower tier municipality wants to take on something like I just suggested that wants to add to that, and then I throw that just out for discussion, because that's something that we're maybe considering as making this like a 5-year event moving forward to, and it's not coming out of a levy. It's still something that the municipality staff is, because when you take on a big event like that, you need the resources versus like a small ag society to do something like that. But you need the resources of the municipality, just the infrastructure to make it happen. But it's not, so it's thinking outside the box sort of thing, right? And I just, you know, I just raised that point.
Well, as I pointed out earlier, there's certainly no restriction for a municipality if they decide themselves that they want to take on to support a project like that. There's no reason why they couldn't do that, even if the group had come to the county for funding as well. I mean, yeah, Buck, I saw your hand up there.
Yeah, thank you, Mr. Chairman. I'm just thinking, as an example, the town of Hanover supports the local hospital to the tune of about $100,000 every year. And that's just sort of automatically done, like, even without an ask. But there's some sort of an update. You know, these are the major things that we're working on. There's a big need, whether it be us supporting, the purchase of homes to house, new doctors. Or the doctor recruitment campaign, or indeed just the hospital or the hospital foundation. So I guess I'm a little concerned about how this policy might impact that long-standing sort of, I guess, policy that's been in place, which is that we somehow support the hospital to the tune of about $100,000 a year. Would that stop them from coming and doing updates, or would they now have to say, okay, we have to be very careful if we want to get support from the county, we better go to the county first? And would that support coming from Hanover on an annual basis have any impact on the county's decision to fund or not fund a request coming from, say, the Hanover and District Hospital?
My sense of that would be, yes, thank you, Mr. Chair, that the purpose of this policy is for significant periodic asks to fund capital and equipment, where it sounds like you've entered into an arrangement in Hanover where the town feels that, you know, it's to their benefit to just provide this kind of friendly, I guess call it a friendly support to things that might be maybe more operating. But if Hanover had a specific big project, they should come to county. They should get support from county if that's what we're doing. And then Hanover could decide that either they want to direct their funding that year or they want to top it up or whatever, but that would be a second thing. But I don't think the funding that you're providing to them annually, which doesn't sound like it comes with it's not a very specific ask on the part of the hospital foundation, would conflict with what we're saying here.
Okay, Buck. Good. All right. Any further discussion on this one? Barb, go ahead.
Yeah, and I go back to my point about, and certainly Buck alluded to it, and I know that Hanover does this as well. We work very closely with our hospital foundation. We're very supportive of their activities, as well as the clinic that has been established in our community. So our taxpayers are heavily invested in healthcare in our community. I think that would be the overriding concern for me, is that having outside hospitals outside of our specific municipality coming to us for requests for support is certainly not something that excuse me, talk much this morning, it would be appropriate given the fact that our relationship is with GBHS first and foremost, as Grey County's healthcare provider in terms of hospitals, and then at our local level with our foundation, since we do have a hospital on our site. I just feel that coming to county, and if the proponents want to double dip, if you will, because that is what it is. I mean, the taxpayers are already paying heavily into this, as they should. But it just to be aware at the county level that this ask has been made of lower tiers. That would be a question that would be asked at the time. And if it has, well, then maybe that's an indication of whether support should be granted or not.
Yep. Okay, any further discussion on the amendment? Okay, I'll call the question. Is anyone opposed? Seeing no opposition, that is carried. So now we're back onto the amended main motion. Any further discussion on the amended main motion? Not seeing any, I'll call the question. Is anyone opposed? That is carried. So thank you very much, Kim. Very good report. Very good discussion. Okay, going back to the main, there we are, back to the agenda. Any other business in front of the committee? Not seeing any. Next meeting date, we may not have, well, I guess we won't have one, because the report that we just adopted showed that we are going to be dissolved. Interesting word, dissolved. Anyway, I'll call for a motion to adjourn. Tom and Paul is seconding that. Anyone opposed? Excellent. Thank you so much. The meeting is now adjourned. Enjoy the rest of your day.